Hi everyone, my name is Emily and I'm a pharmacist here at MDCUSTOMRX. Today we will be going over urinary tract infections. Chronic UTIs are something that can be a huge problem for women, and at times it can seem like there's no solution. In today's video, I'm going to be showing a clip of my vaginal health seminar, and we'll go over various topics such as causes, symptoms, and things that we can do to prevent UTIs from even happening in the first place. Let's get into today's content. And then urinary tract infections, these are a super common issue. I'm sure everyone's had one. They're common and they can happen when bacteria from the skin or rectum enter the urethra, and this can infect the urinary tract. The infections can affect several parts of the urinary tract, but the most common is the bladder, and that would be called cystitis if you've ever heard that. There's many causes of UTIs, including like previous UTI, any sexual activity, and changes in the bacteria of the vaginal flora. For example, menopause, pregnancy, age, because it's like the younger you are and the older you are, like the more likely you are to have a UTI, and then also poor hygiene. Symptoms include pain while urinating, frequent urination, feeling the need to urinate despite having a full bladder, despite having an empty bladder. You might have like blood in your urine or like pressure or cramping in the groin area. If a bladder infection spreads to the kidneys, this can cause a kidney infection, and that can lead to like fever and like back pain. Usually when someone gets a UTI, antibiotics are prescribed, which, like I said before, can mess up the vaginal flora, and then also anti-inflammatory drugs usually. Many times though, a UTI will go away on its own, even like with supplementation of products. In fact, there's been several studies on women who have UTI symptoms, and one study showed that 25 to 50% of those UTIs got better within a week without any antibiotics and only like supportive care basically. So prevention is key with UTIs, and it's important to stay well hydrated and have proper hygiene around the urinary tract. And I'm sure a lot of you have heard of like cranberry juice can help with UTIs and things like that. There was actually a study published in 2017 that had 1,500 women that were at risk of UTI, and that showed that cranberry reduced the risk of UTI by 26%. So that's a big number. Vitamin C can also play a role in like helping with UTIs. It's thought that the vitamin C can like combat bacterial growth. It's important to also be taking a probiotic for women's health, kind of as I mentioned before, just to maintain the vaginal flora. And then there's also what's called hibiscus flower extract and berberine. Those can help prevent bacteria from adhering to the bladder walls. And then when that's used in combination with dandelion leaf extract, the dandelion leaf extract can cause like frequency of urination and kind of excrete that bacteria faster, and just kind of eliminate the bacteria from the bladder. And we actually have a product that contains the dandelion leaf extract and hibiscus flower and cranberry all in one. It's called UT Defense. It's a really popular one, and it's kind of designed to support like kidney and urinary tract health, and kind of help promote that microbial balance. And then, so compounding for chronic UTIs is certainly something that we do a lot. There's a lot of research that shows that vaginal estriol cream, which is a hormone, can be applied to kind of prevent those chronic UTIs, and especially in menopause. It's thought that the estrogen increases the stores of glycogen on the surface of the vaginal epithelial cells, and the glycogen acts as a food source for the lactobacilli, which are the good bacteria of the vagina. And when there's more glycogen, that means there's more of a protective environment. So when women go through menopause and their estrogen levels are reduced, that food source really decreases. So the good bacteria also decrease due to the less protection that they would have. So replacing this estrogen vaginally can be really helpful for patients struggling with chronic UTIs. If you found value in today's video, I would encourage you to share it with a friend and please like and subscribe to our YouTube page. I would also encourage you to watch the full-length seminar on vaginal health that I presented at the pharmacy in March. Here you can learn all about the different vaginal issues and ways to treat them. We'll put it in the link above, or you can also find it in the live section on our YouTube page. Next week, we're going to be talking about yeast infections, so tune in for that. I hope you guys have a great day, and thanks for watching.